Thank you very much for the introduction and for the invitation to the conference. It's really an honor to be here to present for the first time anywhere my research on Sarah Syrkin-Binsztejnova, which has lasted for the last 4 years. And I begin my presentation with a fragment from a memoir written in the immediate post-war years. In her detailed book on life in occupied Warsaw, Helena Sieradszewska describes the second deportation action from the Warsaw Ghetto that began on January 18, 1943. Among those driven that day into the Umschlagplatz was Sara-Zofia Syrkin-Binsztejnova. In Sieradszewska's account, Syrkin-Binsztejnova is spotted standing next to Dr. Israel Milejkowski, a charismatic and authoritative figure who is addressing the crowd, trying to assuage their nerves. I quote, "I see Mrs. Syrkin-Binsztejn, the doctor, and Dr. Milejkowski, who is in charge of the health department, and I can hear him telling all the people who are going to their desks the latest war communique in his calm voice. And they're standing there drinking in his words." Through Sieradszewska's writing, we are witnessing the last moments in the lives of these two doctors. According to multiple accounts of subsequent events that day, Syrkin-Binsztejnova injected a group of doctors with fatal doses of morphine before taking her own life, either on Umschlagplatz or en route to Treblinka. Syrkin-Binsztejnova's appearance in this scene in Sieradszewska's passage is emblematic of her treatment thus far in history books or memoirs. To date, she's not been the subject of serious scholarly consideration. Usually her position and initiatives are discussed in passing and often without attribution. This despite the fact that, as Michel Mazur suggests in the introduction of his important book on life in the Warsaw Ghetto, Syrkin-Binsztejnova was, quote, one of the major figures in Warsaw Jewry. Unfortunately, Mazur himself never mentions her work again. In this presentation, I'd like to fill in the gap in the scholarship about this prominent female activist and member of the Judenrat in the Warsaw Ghetto, to where she returned to public service and the medical profession after her retirement in the 1930s. But in recovering the figure of Zofia Syrkin-Binsztejnova, I focus not on the period of the Holocaust and her work in the ghetto, but instead I consider the formative years of her medical career in the early days of Poland's Second Republic, when she was deployed by the Polish Army as a medical officer working under the aegis of the American Joint Distribution Committee. Using hundreds of documents largely found in the agency's recently digitized archives, I'm able to piece together a more complete picture of this forgotten medical professional and social activist from a time when she spearheaded the anti-typhus and public hygiene campaigns in what was then known as West Galicia. I argue that these pioneering efforts in the years 1920, 1921 set the stage for her advance to Warsaw, where she became a leading force in shaping the public health system in Poland, in particular that serving the Jewish people. My mining of the archives in search of Sara-Zofia Syrkin-Binsztejnova began as an unexpected spin-off of a family research project. My great-uncle was sent to Kraków as a medical commissioner by the Joint Distribution Committee in 1921. The more I reviewed the documents from the Joint's archives searching for my family's history, the more Syrkin-Binsztejnova leapt out of the pages and demanded attention. By placing Syrkin-Binsztejnova as the protagonist in subsequent archival searches, her agency as a central figure in the medical work in West Galicia, and in launching of the Jewish health organization TOS emerged. Sora Syrkin was born on December 15, 1891 in Bielsk, which is today Bielsk Podlaski in Poland. She is related patrilineally to the Zionist theorist Nachman Syrkin, but the exact line of descent is unclear. Education for both male and female offspring must have been important for the family. At least 3 of the children went into the medical profession. Her brother left Russia to study medicine in Breslau, Germany, and Bern, Switzerland. In contrast, Sora Syrkin was accepted into the Kiev Higher Courses, a school for women with a medical program affiliated with the medical faculty of St. Vladimir Royal University of Kiev, and one of only 7 medical programs open for female students in the empire. At that time, every 4th student of the Kiev Higher Courses was Jewish. She was awarded the title of medical doctor at the age of 23 on May 30th, 1915. Among approximately 1,000 women who graduated from medical school that year in the Russian Empire. After graduation, Syrkin moved to Moscow, where she was employed as a doctor at the Red Cross Hospital, a position that provided her with coveted hospital experience and postgraduate training. She subsequently worked as a sanitary doctor in the municipal health system and as a school doctor. In 1917, after the outbreak of the Russian Revolution, Syrkin returned to Kiev and her alma mater, where she was employed as an assistant in the university hospital, working under Vasily Obraztsov and his pupil Nikolai Strazesko, two pioneer cardiologists acclaimed internationally for having in 1910 described for the first time non-fatal myocardial infarctions in a clinical setting. With civil war raging in Russia and Soviet communism spreading to the Ukraine, in October 1918, just weeks before the end of World War I, Syrkin left Kiev for Warsaw, a city that within a month would become the capital of a newly independent Poland. The Poland being sutured together in 1918 after 123 years of partitions was a country devastated economically by World War I, ongoing military conflict with the Soviet Union, and a breeding ground for deadly epidemics. With the health crisis spinning out of control, in 1920, the Polish government created the Extraordinary Epidemic Commissariat headed by a typhus czar, empowered with special emergency staff and extraordinary powers to mobilize resources to lead a coordinated national campaign to halt epidemics. A physician draft was enacted and doctors were placed at the disposal of the commissariat. Sora Syrkin, now figuring in the archives as Sofia Syrkin or Sofia Syrkin-Binsztejnova, was mobilized to the army in March 1920 and delegated almost immediately to work under the Joint, which had been directing funds and supplies under the aegis of the American Relief Aid Administration since 1919. The Joint sent Syrkin to Krakow at the end of April 1920. Syrkin's medical relief work in Krakow and West Galicia lasted 17 months and can be divided into two distinct phases. The anti-typhus campaign focused on Jewish populations of Krakow and West Galicia, which lasted 10 months from April 1920 to February 1921. And two, the period of the operation of the Medical Commission of the Joint Distribution Committee, when she worked as an assistant director under the Joint's Medical Commissioner for West Galicia from February 1921 to September 1921. Excuse me. So phase one. When sent to Krakow, Syrkin was charged with the formation of the sanitary section of the Jewish Relief Committee, an institution established in 1919 to coordinate emergency aid efforts in the region in the immediate aftermath of World War I, including child care, especially for Jewish orphans, of which there was an estimated 20,000 in Galicia. Over the course of 10 months leading the sanitary section, Syrkin's work centered around four main activities. First, surveying the region to understand the scope of the epidemic and set parameters of the medical response. Two, the implementation of a large-scale education and cleanup campaign. The construction of sanitary and medical facilities deemed critical to halt the further spread of epidemics, to offer improved access to health care. And four, developing a network of local sanitary units in communities of West Galicia. The picture emerging from Syrkin's survey of West Galicia was of a region which, in her words, was perfectly helpless before the terrible enemy of typhus. That was a quote. In 1919, the first 10 months of 1920, West Galicia was hit with 24,000 cases of typhus and a case fatality rate of 14%. The Jewish population, made up mostly of urban dwellers, was particularly hard hit. 30% of all of those ill with typhus in Krakow were Jews, but they only accounted for 17% of the overall population of the city. The situation in the countryside was worse. In Silesia, a town in eastern Galicia, 3/4 of the population lived in overcrowded primitive barracks. In a report from Silesia, Syrkin described the extreme destitution. The design of the barracks with narrow quarters and tiny rooms failed to provide a modicum of hygienic living. She described felt-covered walls, quote, radically swarming with parasites, end quote. Medical staff removed 300 lice from the head of one girl aged 12. Central to the strategy formulated by Syrkin in response was the launch of a bottom-up effort to stave epidemic through community education and a house-to-house cleanup movement. Her educational program included the distribution of 60,000 informational how-to flyers in Yiddish and Polish that informed the Jewish residents of West and parts of East Galicia about proper daily, personal, and family hygiene. These handouts were written in a language suitable to a range of worldviews and lifestyles. Communications were published in Jewish newspapers and distributed in Jewish schools and synagogues, as well as from door to door by youth volunteers. Health and hygiene lectures were delivered in synagogues and other public places, and thematic conferences were convened for Jewish community leaders. The heart of the sanitary program was a cleanup movement. Over a period of 3 months, Syrkin led the first in a series of public campaigns to clean up Jewish homes. Jewish neighborhoods were divided into sectors. Trained doctors and medical assistants moved door to door, inspecting Jewish living quarters and the inhabitants. If homes were deemed dirty, a cleaning date was set. The cleaning would be carried out by residents themselves under the guidance of a physician who would arrive on the appointed day with cleaning supplies. Residents received tickets for a free bath at a temporary facility situated in the tents in the Kazimierz neighborhood of Kraków. Before showering, bathers were required to hand over their clothes for cleaning and delousing. The clothes would be returned only after submitting proof that the individual had visited a public bath. Over a 4-month period between June 26th and October 1st, 1920, the sanitary section inspected 5,748 homes and 26,694 individuals, cleaning and disinfecting 3,800 dwellings and 7,967 individuals. This with a permanent staff of 2 physicians and 1 medical assistant, compared to the Kraków Sanitary Bureau with 14 physicians and 14 medical assistants on permanent staff. Within months of its inception, Syrkin's sanitary section launched 2 key investments in Kraków: the night shelter and the ambulatory care clinic. The night shelter, adapted from donated barracks, was the front line in the battle against typhus. Syrkin sourced the constant outbreaks of epidemics in Kraków to the influx of refugees, poor travelers, and destitute people entering and moving about the city. Synagogues in particular were frequently deployed as temporary shelters, creating a significant danger of the spread of lice and a range of serious illnesses to the locals who in large numbers visited these houses of prayer on a daily basis. The night shelter doubled as a public bath, the only free public bath in West Galicia, and a delousing station where 300 people could bathe at the shelter daily. The sleeping quarters could accommodate 192 people. Entering the building happened in controlled stages. Before showering, lodgers would hand over their clothes for cleaning and delousing in an undressing room, accessible directly from the outside. Visitors then passed into the shower room and, after bathing, moved into a second clean dressing room where they retrieved their deloused clothing. No direct access to sleeping facilities was available from the bathhouse and delousing station. All bathers received certificates confirming the date of their bath. The ambulatory care clinic was built to fill in for the lack of a Jewish hospital. The new clinic represented one of the few places Jewish residents could go when ill. In the first month of operation in the late summer of 1920, the ambulatory treated 1,255 patients. Phase 2, from February 1921 to September 1921. At the beginning of 1921, the Joint sent a medical commission from the United States to Poland made up of 13 doctors, 2 public health specialists, a dentist, a pharmacist, and a secretary who set up regional offices across Poland, in the Baltics, and Romania. The Joint's medical commissioner for West Galicia was Erwin Michlin, a Russian-born, US-educated medical doctor. When he arrived in Kraków, Michlin noted he was essentially just taking over the reins of a pre-existing operation. Formally speaking, the Joint's medical commission absorbed the sanitary section, and Syrkin became Michlin's deputy. In substance, however, the main thrust of the work in West Galicia endured in accordance with the program initiated by Syrkin 10 months prior. The work in this period was punctuated by emergency responses to outbreaks of epidemics of typhus, dysentery, and cholera. These responses were led by Syrkin-Binsztejnova in tandem with Michlin. For example, when a particularly virulent typhus epidemic exploded in Mościska, they assembled a 7-person emergency response team that converged on the East Galician town to combat the epidemic. By the summer of 1921, however, the medical relief program was in crisis, and joint leadership was exploring ways to phase out the relief program in favor of longer-term reconstruction efforts that would be coordinated by a national organization and district committees. It was at this time that Syrkin-Binsztejnova, noted for having freed Krakow of typhus fever and for result-oriented grassroots relief work, was moved to Warsaw to head the Public Health, Education, and Propaganda Department. Within months of her arrival in Warsaw, she presented a four-pronged strategy, all reflecting her experience in West Galicia, that would serve as the nucleus from around which the central public health system known as the Society for the Protection of the Health of the Jewish Population in Poland, or TOZ, Towarzystwo Ochrony Zdrowia Ludności Żydowskiej w Polsce, would emerge. The main points in her program included: 1, a national public health education program involving the dissemination of information on disease prevention, hygiene through public lectures, exhibitions, home visits, and the distribution of printed informational materials. 2, the construction of public sanitary infrastructure. A third pillar of her public health education program was tied to the improvement of children's health, with a special focus on the health and welfare of children enrolled in religious schools such as Heders and Talmud Torahs. 4, Syrkin-Binsztejnova called for a substantial enlargement of schools and training programs for public health personnel, with an emphasis on nursing education. Jewish women were excluded from attending the new Red Cross nurses training programs. Syrkin-Binsztejnova's draft curriculum and budget for a 2-year-long nurses course was highly praised by an international consortium of recognized experts in nursing education, and served as the basis for the formation of the well-regarded Jewish nursing school in Warsaw, run by the American nurse educator Amelia Greenwald. I'll add that in the film last night about Alla Margoli, she talked about the nursing school, and this is the beginning of that nursing school by the work of Syrkin-Binsztejnova, which she later handed over to Amelia Greenwald from the United States. Over the course of 1922, the Joint began phasing out its medical relief work, passing these healthcare activities down to district committees in the regions. On a national scale, a national board of elected representatives under the leadership of Syrkin-Binsztejnova began working on a charter for a national health organization, TOZ, which was submitted for approval to the Polish Ministry of Health in October 1922. Syrkin invited delegates to the first National Conference of TOZ in the summer of 1923. In October 1923, the Medical Sanitary Department of the Joint was closed down, and TOZ assumed responsibility for all aspects of the Joint's medical program in Poland. Syrkin-Binsztejnova, a key driver in the formation of TOZ, had earned inestimable respect amongst Jewish joint leadership in Europe and New York. In July 1922, Syrkin-Binsztejnova was offered the post as top manager of TOZ. It is impossible to speculate based on the documents as to her motivation, but she turned the position down. However, in November 1922, she transferred over from the joint offices in Warsaw to TOZ, becoming the organization's founding director, working under Gershon Levin, who would hold the post of chairman until his death in 1939. On his departure from Europe in September 1923, J.J. Golub, the last of the original team of medical commissioners to leave Poland, called TOZ an experiment at best. But the experiment Syrkin launched with her transfer from Krakow to Warsaw did succeed. By 1939, there were 70 TOZ chapters in larger towns and 41 sub-chapters in smaller communities. The organization ran 368 medical clinics and public health institutions and employed 962 full-time employees, including 243 physicians, 118 nurses, and 35 dentists. Public health education, so important to Syrkin-Binsztejnova's work in Galicia, remained one of the paramount tasks of TOZ. The organization was referred to in wide circles in Poland as the Jewish Health Ministry. Over the course of 15 years of its existence before the war, nearly 500,000 people attended TOZ public health lectures. In now my conclusion. Scholar Gershon Bacon argues for the importance of research on the interwar period to illuminate our understanding of women's activities during the Holocaust. In conclusion, I will only briefly summarize Syrkin-Binsztejnova's medical work post-1939 as a way of illustrating the connections between the two eras. The Nazi invasion of Poland plunged Syrkin-Binsztejnova back from early retirement into the world of public health, emergency relief work, and the battle against epidemics. Syrkin-Binsztejnova became affiliated with Jewish self-help, Jewish social self-help, TOS, and the Jewish Council. In late 1939, she assumed the role of chief physician at TOS, the organization that she had been so engaged in creating, overseeing the medical care at refugee shelters. When the first of two major waves of typhus epidemics broke out in the spring of 1940, Syrkin-Binsztejnova transformed her medical sanitary unit serving the refugee centers into the TOS department for combating epidemics. In January 1941, Syrkin-Binsztejnova's department was absorbed into the German-controlled Jewish Council, with her department for combating epidemics serving as the foundation for the formation of what would become the health department in the Judenrat. In addition to holding the position as a director in the health department, Syrkin-Binsztejnova also headed the office of the Inspector of Hygiene. One of her important initiatives in the 9-month tenure at the council included the founding in June of 1941 of the Chemical and Bacteriological Institute, a laboratory and research center which, among other undertakings, carried out food testing to help prevent and control food-related illnesses and disease outbreaks in the ghetto, as well as testing of vaccines reaching the ghetto, oftentimes clandestinely, to determine their quality and effectiveness. The battle against typhus, however, remained the main focus of her work during her 9-month tenure at the health department. Syrkin-Binsztejnova's time at the Judenrat came to an abrupt end following one of the most brutal of the German blockades and mass delousing campaigns, the Krochmalna Street Aktion. The medical and humanitarian disaster elicited a response on the part of Dr. Wilhelm Hagen, the German health official for the Warsaw district, by most accounts, the chief architect of the harsh and ineffective anti-typhus raid on Krochmalna Street. Hagen passed culpability for the deplorable conditions on Krochmalna on Syrkin-Binsztejnova. In a meeting with Adam Czerniaków on September 15, 1941, Hagen forced her dismissal from the health department of the Judenrat. For the next 14 months, she remained active with TOS, and from many reports was captured in the line of duty with other medical professionals and activists and committed suicide with them on January 18, 1943. Thank you. Thank you.